Welcome back to Lipstick and Lipo, your unfiltered guide to plastic surgery by two board-certified plastic surgeons. My name is Dr. Ashley Amalfi. I'm a board-certified plastic surgeon at the Quatella Center in Rochester, New York, and I am joined by my colleague and dear friend, Dr. Smita, and we are talking recovery today. So we have so many good episodes about recovery, and those are like our heavy hitters. So today we are talking about recovery after tummy tuck. Are you excited about this one, Smita? Do you get a lot of questions in the office?
Yeah, I mean, I think we get a ton of questions, right? Because it's the most important thing. When you're talking about surgery, you want to be able to plan for it. And a lot of that has to do with recovery and recovery time and all of the restrictions you're going to have. So we're going to break it all down for you on this episode of Lipstick and Lipo.
I think people are terrified of tummy tucks, and I don't really know why. Like, when you say tummy tuck, everyone's like, oh my gosh, I don't have enough time to recover after a tummy tuck. So I don't know why it gets such a bad rap, and people think it's like something that's so great that they're not going to be able to recover from it. But I think it's really important that we talk about it today, because I don't think that the tummy tuck recovery is really so bad. And I mean, you're a bunch of women. You've gone through a lot of harder things than recovery after a tummy tuck. So I think we're going to break it down for you today and make you way less worried about what to expect after your tummy tuck.
Right. I mean, I think overall, right, the biggest thing is just the overall time, right? It's not necessarily the pain or anything like that, but it's just giving your incisions and all that just some extra TLC as they heal. But having said that, I mean, I would say the first week is probably the roughest, right? You're not on pain medications the whole time. No. I think most of my patients are off after a few days,
I usually
right?
say, the first 2 days are like the most intense, where you're going to need help, like moving around, going to the bathroom, getting something to eat. You know, someone's going to be waiting on you because you're going to feel really crummy, and moving around is just really hard. So I tell them that's like 2 days, right? And then that's usually the time period where people are taking some of the stronger narcotics, and then after that, I mean, I think my patients are pretty tough, right? Like, I think the rest of the week, like, they're sore and it's not awesome, but they're starting to move around good that first week.
Yeah. I mean, right. They're starting to move around. I mean, do you use drains?
I use drains, and so they'll have those drains. My patients will have drains for a couple of weeks sometimes. So that's just a pain to have, you know. It's
just more annoying, right?
It's annoying.
Yeah, it's more annoying than anything.
Yeah.
So just like learn.
Yeah,
it doesn't hurt.
They're just.
Annoying. I mean, I think just learning how to like maneuver with the drains, because you literally have two tubes with little suction bulbs hanging off through the incision. So maneuvering that and trying to get around and staying bent over, it's more of the annoying parts of recovery. But I don't. And, you know, the muscle repair, I think more than anything, is what's going to be the most uncomfortable. But, you know, we put numbing medication in there that's long lasting. A lot of, you know, I give a light muscle relaxant, which really helps until sort of the muscle is, I always say whenever we move muscle, it wants to go back to where it came from. So it spasms. So that's what you're going to feel. But that usually all resolves by that 1 week. I think what's interesting is, do you hear this from patients? They complain more about not being able to sleep, because if you're not a back sleeper, you're sleeping on your back, which means you may not be sleeping well. So that's what people complain about the most.
Yeah, more so than the pain or anything else. I think things are just like a little annoying and uncomfortable, and you're so used to your routine that it's like small annoyances that you have to kind of take account for, more so than it's like unmanageable. And so I mean, like, good tips for sleeping are to like sleep in a chair or sleep in a recliner, or I always tell patients to like pull out those pregnancy pillows, like those big kind of curved,
the big boppy pillows.
Because they kind of like stuff you in, and then you can't roll around, and it prevents you from rolling to side. So just finding like little quirks like that to help you with these little things, like little tips to use your drains, and how to get in and out of the shower with the drain, how to go to the bathroom easily. I think it's just like these little things that add up that are like annoying as part of your recovery, as opposed to it being really that overall hard.
Yeah.
You know, do you have a lot of patients who are working from home now? And I feel like this is like a game changer. Do you have a lot of work at home?
Oh, yeah.
Yeah.
I mean, a lot of my patients are starting to either do the hybrid or they're back at work.
Yeah.
But when pretty much everyone was working from home, it was awesome because you could still hop on your computer as long as you were not taking the pain medication. So usually, I usually tell people after 24 hours of no pain meds, you're pretty much like awake, alert. You can go back to work.
Yeah.
So it's great because you don't have to take a lot of time off of work to recover from these surgeries as we did in the past.
Even if your office is back in person, the option is still on the table because you guys already have the tools and your office is already set up to work like that. And so if you just say you're having surgery or a medical procedure, take the first week off so you can rest and take naps and whatever. But then like after that, just get back into the groove of working from home for a little bit. And if you work from home for another week or two, then before you know it, you're back to work and doing anything you want. And so it's just such a nice convenience that's it's like changed everything for us for tummy tuck recovery, because all these people who never could take any time off of work, well, you know what? Everyone can take a week.
Right. And just plan it around your vacations, your holidays, even if you can't take extra time off of work. So the first 2 or 3 days are probably the most painful, right?
Yep.
I usually tell people that they are going to be walking sort of bent over for 5 to 7 days, roughly, right? I guess it depends on how tight we make you and how quickly your skin sort of stretches. But by that second week, most people are sort of upright.
Yep.
Drains come out usually first, second week, maybe third, depending on how much is draining, right?
Yep, that's how mine are too. 1, 2, or 3 weeks. Yeah, everyone's different.
Right.
Some people everyone wants their drains to come out early, but the downside of taking it out too early is that fluid builds up and your body can't absorb it, and then we have to drain it in the office, and we promise that's not better. So
it's not better. It really is not.
if you're one of those people whose body makes a lot of fluid, or you're active and you're making a lot of fluid and it has to stay in for that 3-week mark, that's the very longest it's going to stay in, but your body needs it. So it's annoying, but it's okay. In the grand scheme of life, 1 more week, it's not
a big deal.
Yeah.
It's not a big deal. So just sort of be patient with it. But once those drains are out, everyone feels, it's like you just feel like a different person, right? You feel free. You're not like tied down.
Excited. Yes, everyone is so excited to get drains out, because then you're just kind of like your body on its own, and you're kind of moving around, and everything just gets so much less annoying and so much easier. It just feels like a return of normalcy.
Right, exactly. And then do you have people wear a compression garment or a binder or anything like that?
Yeah, my patients wear compression for a few months. So they'll wear the surgical one usually that first month, and then after that, once drains are out, I'll let them switch to different, softer, more comfortable compression if they want, like Spanx or, something that you just buy on Amazon or Target or something like that. Is that similar to what you do? Yeah,
same thing. I mean, I like the binder just because in the beginning there's so much swelling that you have the ability to really adjust everything. And that, you go home with from surgery. And then, but same thing, once the drains are out, after that 4 or 5 week mark, once a lot of that swelling is sort of gone, then they can switch over to literally anything. But the compression is good. And I do require it for the first 6 weeks, some sort of compression.
Yeah.
As close to 24 hours as you can. You can take breaks, obviously take it off when you shower and all of that. And then after that, I always tell them the more the better.
Yeah.
It's just an added benefit if you can wear it more. So
I mean, even like altering your clothing so that you're wearing really tight yoga pants more of the time, because even like tight, high-waisted yoga pants are going to give you some compression, which is going to help with the swelling. So, getting used to sleeping in those is not a bad idea, because the more compression, it's really going to feel better, which is hard to understand until after. And then patients will tell you when they move around, it shakes, and it's actually feels better to be in the compression, even though it's hot or annoying or sweaty, because it just helps everything feel more compact, and it just feels comfortable in a way.
Right. I mean, you just have that extra support, because I think after surgery, you just, everything just it's new, right? This part of your body is new. And so any sort of extra support just, I think, mentally helps,
Yes,
to know
it
that you're not going
reminds
to
you.
pull a stitch or, whatever it is. But it just reminds you to sort of, because I think at that 4-week mark, I always tell patients at that 3 to 4 week mark is another time that I start to worry about people, because you forget that you've had surgery because you feel so good.
Right.
And then you're just like, oh, okay, I'll just do this, I'll do that. But then you can backtrack.
Overdo it, yeah.
You can overdo it. So the binder is another way to sort of remind yourself, okay, I have to wear this for 6 weeks. I have to be a little careful for the first 6 weeks. But then after that, you can sort of let loose a little bit.
Yeah. I love how you tell people that I've heard you say this before, Smita, that their body will give them restrictions, after that point.
Yeah.
And I think that's what I tell people too. Like, then, after that, you just listen to your body. And if something hurts, then you shouldn't be doing it. But if you do something and you feel okay, and the next day, it doesn't feel like you overdid it, then it's probably okay. And then you just kind of baby steps work your activity up. But, it's not long before you're getting back to normal activities and adding things in. And before you know it, it's far, in the rearview mirror. And here you are with your new flat tummy, and a couple weeks is really worth it.
Yeah. It's so funny. I actually had a patient, it must have been a few weeks ago. I had seen her, I think for her 3-month follow-up or something. She was like, our last fit. So I usually see people at 6 weeks and then I see them at 3 months again.
Yeah.
And she was like, I didn't really understand what you were saying. You kept on saying, listen to your body.
Yeah.
She was like, I don't even know what that means. What do you mean? But she was like, but then, 2 weeks ago, I tried to go for a run or whatever she was doing. And she was like, oh, this is what she meant by listen to your body, so she overdid it. And so you're just more aware of it, and your body will get you back to where you were. You just need to give it some time and some grace, and it'll be there. The other thing that I think is interesting is I hear this a lot from patients too, that first week, because that first week is a lot, right? There's drains, you're bent over, there's a lot of things happening. You're not sleeping, you might be constipated. It's another thing from the pain medication. But a lot of patients are like, oh, why did I do this? But every single person by that second and third week, they're like, oh, I should have done this sooner.
I turned the corner. Yeah, they're like, oh, I turned the corner. I feel like myself again. Yeah. That intense period is not long. And then as soon as it's gone, it's gone. And you're just like, oh, you just wake up at some point, whether it's day 2 or day 7 or day 10, and you're like, oh, okay. I feel like myself again, and I could do that again. That wasn't so bad, and I love the way I look, and then you're on with it.
Yourself but better, right? I mean, you have this nice stomach. You can wear all those clothes that you've always wanted to wear. Throw in that bikini.
How about
it's a great surgery.
How about core exercises? Do you wait a little bit? I wait a little longer than other exercises to add core back in when I'm doing a diastasis repair, so that muscle repair. I never really want to stress that. So for me, it's 2 months. That's the very last exercise that they add in is that core work, just because I don't want them to strain it. And I tell them if it hurts, it's not ready yet. Is that what you do?
Right. That's the same thing.
Yeah.
Same thing. And, and even when they start to go back to that, I sort of tell them to do the version that they're old, the grandma version, right?
Yes.
You don't do your planks, do it on your knees first, or do wall push-ups, just
modify.
Start really, really slow, do the modified version, and then build yourself up. But I think that muscle repair, we really want that to be nice and strong and healed before you start sort of building that muscle back up again.
Yeah, absolutely. And sometimes, I'll send patients to physical therapy because their muscle separation is so significant, or it's been like that for so many years, that you kind of forget how to really work out your core and strengthen it again. And even though the muscles are repaired, they're really weak from being separated so significantly. And so I've been sending patients more and more for physical therapy, and finding that it's just helpful to teach people how to use it appropriately again. And so if we're sending you for that, it's not because I don't think you can do it. It's because I think it would actually really help you just kind of get back to your baseline, and it will only make your result better, because the better that core is, the stronger it is, the flatter your tummy is going to look. And that's I mean, that's what we're here for. We're talking about tummy tucks. That's
what we're here for.
It's the name of the game. Yeah.
I know. I mean, and it's going to improve everything, right? If you're a runner, it improves your running, it improves your posture, it improves your results.
Yeah.
Your long-term results, back pain. Yeah. So it is really a game changer.
Doing stuff around the house. Like everything is going to feel better when that anatomy and that internal corset is back where it used to be. So tummy tuck is a game changer. I mean, patients look phenomenal. They feel amazing. After just a couple of weeks, you're going to be thrilled with these results. And the reality is the downtime is not that crazy. It's probably like one really intense week, and then we kind of slowly, baby steps, get you back to normal. And so don't stress about it too much. It's totally worth it. And I have yet to have a tummy tuck patient who's like, oh, I wish I didn't do that.
I didn't do it. Yeah, words I've never heard.
Never happened. That has never happened. So that should tell you are tough enough. You could totally do this. Stop talking yourself out of it.
Yeah, don't talk yourself out of it. Come see one of us, or another board certified plastic surgeon will walk you through it. But what's also really awesome is that your results only get better, right? I mean, that first year, every month you're getting better. Your muscles are getting more defined. The swelling is going down. Those scars are settling down. So the results are even better. But then also what's really cool, especially those patients that don't have a lot of fat or extra skin, but it's more diastasis and you haven't been able to work out. Well, it's just that like added motivation where you're like, oh, I've had this surgery. I look great. And then you just go into like workout mode, and then you make those results even better just by nature of your lifestyle. So good. It's an awesome surgery. So don't be scared. And we'll walk you through the whole process. That's what we're there for.
That's why we do it over and over and over again. So don't you worry. So thank you guys. This was an awesome episode. Recovery after tummy tucks. We got so much other great content. So tune in. Lipstick and Lipo on YouTube, podcast on Spotify. Make sure you subscribe so you catch all the latest content. And we will see you for a new topic soon. Take care, Smita.
Bye. See you later, Ash.
Bye, girl.